Hello and welcome to our channel. This is Dr. Orora Maranga, consultant gynecologist and cancer specialist at Janice Hospital in Nairobi. Last week we started a series on family planning methods, and we did discuss about how to choose the most effective family planning method and how to do so, and the various methods. And today we are going to look at a very sensitive aspect, and that is the side effects of these methods, the family planning methods. Now, to start with, the side effects usually depends on the method which is being used, and we cannot say that a contraceptive method will work the same way from one individual to the next. Most of them do well for most women, but there are some which would cause side effects, which often, if persistent, can lead to discontinuation of that method by a woman. And the reaction is usually different from one woman to the next, and it cannot replicate how one body processes these hormones or these devices. Now, going straight to the side effects, if you look at the hormonal contraceptives, they tend to cause more side effects as compared to the non-hormonal types. And for the hormones, if you look at the pill, for example, this one is usually taken every day. And it's usually taken every day, and it may cause mood changes, may cause weight gain. Weight gain may be one of those other aspects, may cause nausea in a number of women. Others may report of breast tenderness. Those are the pills. And others, like the injections, those are the Depo-Provera injections, which are given every 3 months. That one is notorious for weight gain. You may find within a short time there is quite increased weight gain. Others may report of irregular periods and also mood swings, and others may even report of reduced libido and also reduced bone densities. The others are implants, like no plant, for example. Those may cause irregular periods, irregular cycles. They may cause spotting, or they may cause heavy bleeding, basically bleeding which is abnormal. But in most women, you find they go many months without a period, which a number of women do appreciate that particular aspect, although that worries some that they're going several months without a period. But that is also how they do work. The mood changes also may do occur. Some women may have severe headaches, and of course I've just mentioned about weight gain. For the coils, the side effects of the coils, it depends if they're hormonal or if they're non-hormonal. For the non-hormonal, they will not cause what we have just talked about in terms of weight gain or mood changes or irregular periods. Those are like the copper-T contraceptive devices, intrauterine contraceptive devices. But others like Mirena, those are coils which do contain hormones within them. Those ones may cause irregular periods, reduced flow, spotting on and off, and because of and a bit of the cramping can occur. Of course, the other methods like condoms, there are some men and women, although rare, do react to latex material, and therefore they cannot use those condoms. The others are patches. patches. They're basically, as the name implies, you patch on the skin, and they work the same way as the pill. They are hormonal, and some women do react, and they may have skin reactions to the patches, and the rest of the other side effects are similar to the pill, like weight gain, mood changes, and such like, and breast discomfort. Now, we've talked that these side effects, they don't occur in everybody, and they don't have to happen or to occur when you are using a method. There are many women who use these methods, and for many years and for many months and for long periods, and yet they have never experienced any of these side effects. That's why they are called side effects, because they are not intended to occur. Now, do all family planning methods, have side effects? The answer, unfortunately, is yes. All the methods available in the market worldwide, they all do have side effects. But the good news is those side effects don't have to be reflected in you when you are using them. So some will develop the side effects, others may develop none of the side effects. So it depends on the individual's body. And when should, let's also look at an important aspect. When should a woman consider changing the family planning method? Now, this depends on the general health and the general circumstances of a woman. If this do change, then you may have to change the method. Say, for example, in terms of age, if you've had a coil before, you've used hormonal contraceptive before, you're approaching a certain age, and your fertility goals have changed, then you may consider changing your method. For example, if, say, one has been using the hormonal contraceptives, the pill, for example, the implant, the injections, and now they're above the age of 35, they're heading 40, they should consider stopping the hormonal contraceptive and trying out the non-hormonal contraceptive, because it tends to have less side effects at an age. And if one has the desired family size, then you may consider, as a couple, going for the more permanent contraceptive method, like tubal ligation or vasectomy. If you do develop health conditions like high blood pressure or diabetes, then it will be best to avoid hormonal contraceptives, and it's always good to consult with your doctor before you change your method. The other aspects are, if you find yourself you're adding a lot of weight on a certain method, or you're losing a lot of weight on a certain method, then you should also see your doctor, and hopefully should be able to change that method. And circumstances is, if you find you're developing acne, pimples, you're developing a lot of hair, then it may be time to change the method. There are other more severe life-threatening conditions which can occur with contraceptives. They are rare, but they can occur, like developing clots, deep venous thrombosis. This is where you have clots forming within the veins of the legs, DVT as we call it, and those clots can be dislodged and they go all the way to the lungs. Condition we call pulmonary embolism, which is very, very serious, life-threatening, and can kill. If one has had such scares, then they should never use hormonal contraceptives, or if they have been using, then that has to stop. And migraine, severe headaches, severe side effects like mood changes, which can border or go into depression, then such a method should ideally be changed. And if there are severe persistent situations like heavy bleeding, which may even lead to anemia, or continuous bleeding, then that should also help or be instructive that one should change the method. And as we finish, I would say as a gynecologist, I've seen many women suffer with various side effects caused by family planning methods, and they suffer in silence. It shouldn't be like that. If you have any side effect which you've developed with whichever method you've had, it's best to consult with your doctor and explore individually which method may be best for you, for your body, because one man's meat may be another's poison. This has been Dr. Orora Maranga, a consultant gynecologist and cancer specialist. See you next week for the continued series on family planning.